If your child suffers from chronic ear infections, you know the drill all too well. Endless nights of pain and tears, back-to-back rounds of antibiotics, and the looming threat of surgery. You're tired of Band-Aid solutions that never address the root cause. Once you've experienced this, even just a time or two as a parent, now you begin to worry every time they get a slight little bit of congestion or a common cold, worrying it may spill over and build up into chronic ear infections again and again. For many parents, that is exactly the case. Round after round of ear infections, followed by time after time of pediatrician and ER visits, and of course round after round of antibiotics and all the side effects that come with them. By age 3, it's now estimated that 80 to 90% of kids will experience at least one ear infection, which should then get us asking the real question: what's different about the 1 out of 10 kids who do not get ear infections? If you'd like to stop the cycle of chronic ear infections or prevent them altogether in the first place, then you've got to watch this video all the way through. What if we told you there's a way to break free from this cycle of suffering without relying on drugs or invasive procedures? In this video, we'll reveal the hidden cause behind most chronic ear infections and share a natural, drug-free approach that's helping children find lasting relief. This video is for parents of children struggling with chronic ear infections who are seeking answers beyond antibiotics and surgery. If you're tired of temporary fixes and want to address the underlying cause of your child's recurring infections, then this information is for you. We'll explore the surprising link between drainage, subluxation, and chronic ear infections. You'll learn how birth interventions and early life stressors can set the stage for these issues and discover how neurologically-focused chiropractic care can help restore your child's natural drainage and immune function. We recently shared Parker's story. Miss Parker started at TLC while suffering with her second ear infection in just a 2-month span. Her pediatrician prescribed amoxicillin both times, and it didn't seem to help. Her mom knew that this was not normal and struggled with giving her less than 1-year-old daughter multiple rounds of antibiotics, but she also hated to see her suffering with the pain of repeated infections. Luckily, using our Insight Scan technology, we were able to identify the significant stress and tension locked on Parker's nervous system. In Mom's own words, we were able to find the root cause of Parker's dysfunctional immune and ENT systems and illuminate a path forward to building up her body's natural defenses. Parker's mom told us 3 months into care that she was no longer dealing with ear infections. In addition, her reflux, moods, and overall immunity were doing better too. We are so grateful this mama trusted her intuition and found a drug-free way to support Parker's health. There are many ways to help kids get through ear infections without antibiotics, surgeries, and all the side effects that come with those. The natural solutions and options not only help get through those difficult challenges, but make the body stronger as a result. Chronic ear infections occur when there is a recurring buildup of fluid, inflammation, and swelling that block the eustachian tube, leading to pressure and pain in the middle ear. This condition is also known as chronic otitis media. There are 3 primary causes of these chronic ear infections that are all tied to something called subluxation. First, there's poor plumbing and drainage. That results from the misalignment causing extra tension, inflammation, and limited movement of the nerves and muscles that supply the inner ear. That then leads to the buildup of fluid. Second, subluxation also causes the body to go into an excessive sympathetic fight or flight state, leaving it in a high inflammatory state and producing extra mucus, so as a result. This way, we end up with double trouble. And lastly, the world we live in has a ton of toxins, sugar, dairy, and so forth. That just stirs the pot and makes things even worse. Since antibiotics and fever reducers do not take the root cause head on, and in fact make the gut and immune system weaker over time, they are a major reason for recurrent or chronic ear infections continuing to come back again and again. In the same way, many families have gone gluten-free and casein-free, added tons of supplements, essential oils, and so forth, and yet they still struggle. That shows that though these things may be helping some, they do not address the root cause or subluxation entirely. Our adjustments are designed to provide 2 main things that help kids get to the other side of ear infections without drugs and surgery. Number 1, they increase the drainage and plumbing by getting things moving and clear once again, often immediately. And they balance out the nervous system, helping to reduce that sympathetic fight or flight state. They also reduce inflammation and just overall take stress and tension away. In our office, the path to natural solutions and overcoming chronic ear infections begins with what we call our neurological insight scans. These scans directly measure the stress, tension, inflammation, and subluxation that so often builds up in the upper neck in infants and children struggling with chronic ear infections, stemming all the way back from birth. Birth interventions like forceps, vacuum, and C-section can create physical tension as well as twisting and pulling to the upper neck and middle ear areas, leading to all of this trouble in the first place. To learn more about how chiropractic can help your child overcome these challenges and to get your child scheduled for their neurological insight scans, hit the link below and learn more today.